Okay, hello to our Realm of Caring community. Thank you so much for joining us today on this webinar that we have. It's an incredibly thought out and wonderful webinar that I'm so happy that Dr. Bilstrom and Dr. Swathi are here to present on CBD and autoimmune disease. So now I'm just going to go ahead and pass it over to our scientific advisory board member, Dr. Swathi. And just as a reminder, we will have some time at the end for some Q&A. So if you have some questions, just make sure you're using that Q&A box as the webinar goes on. All right, Dr. Swathi.
Thank you so much. Yeah, Dr. Bilstrom and I are so excited to be here. Some of you who have, been a part of the Realm of Caring webinars before might recognize me. I've been here a few times. I love interacting and answering questions for the Realm of Caring community. So any questions you have, please feel free to drop them in the chat. Today, we're going to be talking about autoimmune disease and then putting it in the context of how CBD could potentially be a part of a comprehensive treatment regimen for it. And so we're going to start with really the background, what autoimmune disease is, why it matters, who it impacts. And then after that, I will speak a little bit about CBD and how it can relate. So I will pass it off to Dr. Bilstrom and mute myself for now.
Hello, everybody. So nice to be here. Now, I find the body and the immune system absolutely fascinating, and I hope that after our time together, you will too. Now, I tend to say a lot that the body and the immune system is super, super complicated, but I hope you agree with me at the end that it's also super, super logical how it all works, and that logic, the science we know, tells us so much about what we can do to prevent this stuff, but also to reverse it once it's well established. And it's so nice to lecture with Dr. Swathi again. So please, next slide. So today, hopefully we're all going to agree that we're going to understand the scope of the problem, and boy, is it a big problem that is autoimmune disease and the immune system disruption, understand the importance of changing the way that autoimmune disease is dealt with worldwide, and understand the role that the endocannabinoid system plays in immune system health. So it is a big problem. It's a leading cause of death among female children and women 65 years of age and younger. You think cancer is a big problem? Well, $100 billion is spent every year in the US for autoimmune disease care, compared with only $50 billion, half of that, for all cancer care. Autoimmune disease is the most popular health topic, requested by calls made to the National Women's Health Information Center. 80% of people who get autoimmune disease are women. We're going to touch on that, dive into that. And people want answers. 720,000 searches per month in the US alone with the term lupus, and another 440,000 for lupus syndrome. Big problem. People want the answers. Next slide, please. So we now know that there's an autoimmune disease component, of course, to the traditional ones like rheumatoid arthritis, multiple sclerosis, Hashimoto's thyroiditis. But we now know there's this autoimmune component to so many health issues we didn't think were autoimmune related, immune system related, including Alzheimer's, autism. 70% of all autism is one particular autoimmune disease, osteoporosis, migraine headaches, seizures, heart attacks, strokes, et cetera, et cetera. Next slide. So I think this is very telling. Now, you could substitute atherosclerosis for just about any health issue, but this quote is just beautiful. Atherosclerosis was once considered to be a degenerative disease that was an inevitable consequence of aging. However, research in the last 3 decades, the science we have has been going on for decades, as you can see, has shown that atherosclerosis is not degenerative or inevitable. It is an autoimmune inflammatory disease associated with infections and inflammatory factors. So one of the big parts of this is, oh my goodness, this is part of just about any chronic disease, but also infections that drive chronic disease. We now know that infections are part of every chronic health issue. They just tend to be the infections that drive chronic disease, which usually are different than the infections that will drive obvious disease, such as high fevers. Next, please. So 1 in 6 US women alone have Bilstrom's nuclearitis. Now, you may have recognized some of the other disease processes that I've gone through, but maybe this one is a new one. But this is almost 30 million US women of childbearing age alone. just childbearing age, making it probably the most common autoimmune disease. Now, it's very important that this was given a name, and the next slide will take us to that point. So Bilstrom's nuclearitis is a positive ANA, a positive anti-nuclear antibodies. Antibodies attacking our own nuclear material, our own DNA, without antibodies against other parts of the DNA yet. So I named this in 2018. It was published in a pain management textbook in 2020. So why was it so important to name this? Of course, it's incredibly common as we went through, but why was it so important to put a name on this? Next slide, please. So historically, a positive ANA was not treated, as it was just considered primarily, quote, not a fully formed autoimmune disease. Now, this is so silly. Why would we wait till a disease is fully formed to do anything? It's kind of like diabetes. Well, you have pre-diabetes, you have insulin resistance. Well, we're not going to do anything until it's fully formed diabetes. Well, how silly would that be, right? Now, I mean, big picture, we don't do a very good job of addressing diabetes long before it becomes fully formed. We have 10 to 20 years to do that. Oftentimes, we don't do a very good job of that. But why wait for something to get fully formed before treating it? Gosh, if it's on the pathway to something terrible, let's treat it before it gets terrible. Next slide. So one of the problems was we really didn't have a name for a positive ANA. And in medicine, we like a name. We're not quite sure what to do without a name. But also, when ANA was identified as being positive on a simple blood test, people were told, well, we're just going to wait. Now we know that this ANA means that in about 3, 5, 7 years, you're going to start making antibodies against other parts of your DNA. And then we're going to be able to tell you that you have rheumatoid arthritis or lupus or Sjogren's or mixed connective tissue disease, et cetera. We know that's where you're going, but we're just going to wait and you'll feel worse and worse. And eventually we'll be able to tell you which one of these you're going to get. Next slide. But then after waiting and waiting and getting worse and worse and worse, all people are offered are medicines that put a Band-Aid on a few symptoms while still increasing the risk of cancer, life-threatening infections, and actually there are thousands of case studies where these type of medicines actually give you as a side effect a new autoimmune disease. So this first reference here, it says immunotherapy of autoimmunity and cancer, the penalty for success. Well, is putting a bandage on a few symptoms really a success, especially when it causes increased risk of cancer? Next slide. No, of course not, right? That's a very rhetorical question. Of course it's not a success when a medicine just puts a temporary bandage on a couple symptoms of an autoimmune disease while simultaneously increasing your cancer risk. True success is possible and really should be the standard of care. Next slide, please. So now a positive ANA has a name. It has a diagnosis. Now we can start to address this autoimmune process immediately, but not with Band-Aid medicines. Next slide. Now, when a parent has an autoimmune disease, we love to see the children because when a parent has an autoimmune disease, the children are so much more likely to get every autoimmune disease, not just the one the parent has. And this is a great example of how truly they're not hundreds of autoimmune diseases. They're really just one disease that can attack any body part. But we also, the corollary is when we see children, and we're so fortunate, we get to see children with autoimmune disease from every state in the US and across 21 time zones worldwide. When we see a child with an autoimmune disease, we want to see the parent too, because things run in families. Maybe not the exact same disease, but the thing that causes the disease runs in families. So like, for example, if a parent has rheumatoid arthritis, the child has a 5.4 times greater risk of getting type 1 diabetes. The autoimmune disease that stops the pancreas cells and make an insulin, and you require insulin pump until you reverse it. That's another lecture. But the child may show up with the autoimmune disease of type 1 diabetes, for example, before the parent gets the rheumatoid arthritis, right? And wow, a 5.4 times greater risk of type 1 diabetes, not twice the risk, 3 times the risk. Holy cow, does this stuff run in families? Next slide, please. And this is a big one. And this is a big one as to why 80% of the people that get autoimmune disease are women. Estrogen dominance. Too much estrogen compared to progesterone. Whew. Now, this title of this reference, The Necessary Evil for Human Health, ways to tame it. There's a bias in medicine. I don't think you'd ever see somebody say testosterone, the necessary evil for human health, and the ways to tame it, but they talk about estrogen this way. Next slide, please. So, what happens when a woman develops estrogen dominance, too much estrogen compared to progesterone? Well, all the hormonal menstrual things. So, we're really trying to educate people on what this looks like long before it becomes something even worse. But these things listed on this slide are pretty darn bad already. So, all the hormonal menstrual stuff, bad flows, bad cramps, PMS, ovarian cyst, polycystic ovarian syndrome, fibrocystic breast disease, fibroids, endometriosis, infertility. Oh my gosh, if a woman has any of those things, or multiple, oftentimes, we know she has estrogen dominance. We got to fix it, make those go away. This estrogen dominance is terrible, but also, and this is what makes it so unbelievably common, is because estrogen revs and progesterone calms, women get rev without calm things such as excessive worry, anxiety, panic attacks, insomnia. This is so common. It didn't used to be so common. I see women in their 80s and 90s where they go, geez, I never had any hormonal menstrual things at all. Never had a bad cramp, a bad flow, menopause. I just stopped having my cycles one day and I was done. It is so hard to stay healthy nowadays. It's almost hard to find a woman who doesn't have one or more of these things going on. This estrogen dominance is so common. And I would ask all you, yourself, a child, a parent, a grandparent, anybody have any of these things? I think it'd be hard pressed to find more than 5% of people not raising their hand on this. Next slide, please. It's a huge reason why 80% of the people that get autoimmune disease are women, but and it may seem kind of crummy already, but it's even worse. But it's so important. It's great to know this so we can prevent this from happening before it happens. Next slide. Estrogen dominance before menopause. Women have a 5.4 times greater risk of breast cancer before menopause. Wow, not twice the risk. Now, in the morning news programs, they have the ticker down below, health stuff, political stuff. Well, across that ticker, if it came up that something was identified as doubling the risk of a woman getting breast cancer, oh my gosh, national emergency. Triple, 3 times the risk, oh my gosh. But it's much worse than that. It's 5.4 times greater risk of breast cancer before menopause, but also a 10 times greater risk of the malignant cancers, the ones that start someplace and metastasize other place, the bad ones, 10 times greater risk lifelong. Oh my gosh, this estrogen dominance is terrible, but so important to identify for what it is when it turns into these rev without calm things, hormonal menstrual things, long before it becomes a cancer. We can address it, get rid of the crummy things that they start with, but we're really putting a woman in a great position not to have to deal with breast cancer or malignant cancers later in life. Next slide, please. So this is the immune system. Now, the body loves balance. You never want to be too high, too low in anything, blood pressure, blood sugar. But the immune system is so fascinating because when you lose that set point right in the middle, you actually move away from it up and down at the exact same time. So the overactive immune system, all the autoimmune diseases, allergies, asthma, and eczema, underactive immune system issues, colds, flus, infections, getting the same infection over and over again, including in children and young people. You see recurrent ear infections, strep throat, sinus infections. You see allergies and asthma and eczema. They've already lost this set point. They're moving away from it. We got to reel it back in, bring it back to the middle before they ever end up with autoimmune disease, cancer, or the infections that drive chronic disease. So you see somebody with up stuff or down stuff, you lost your set point. We got to get you back to the middle so you get rid of what you got already. But we also want to put you in a position not to get new stuff as time goes on, such as here comes autoimmune disease or cancer. Next slide. Now, the things that cause that loss of the immune system set point are very specific. So this is an overview, but I kind of want to put it in order of the most important. We talk about the 7 central mechanisms. Next slide, please. So many of you out there may have guessed what the central mechanism is, and it's the gut. One reason is the gut is such a central mechanism for so much stuff in the body, for most things in the body, but including 80% of the immune system surrounds the gut. And so if you ever see an immune system issue, the first thing you should think about is what is going on in the gut. And a big part of that gut is the intestinal microbiome. Now, we also have the stress hormone cortisol, always plays a part in this chronic stuff, autoimmune included. Hidden infections, infections that drive chronic disease, can be tested on simple blood tests. Any lab can run them on stool tests to see if this one's in the gut. Food sensitivities. Now, people can figure out immediate hypersensitivity reactions to foods themselves because every time they eat something, they just don't feel very good. Extreme example might be peanut allergies. Every time a child eats that, let's say, or an adult, throat closes up, gotta go to the emergency room. Could be I get gassy when I eat ice cream, but the food sensitivities there are delayed. The delayed hypersensitivity reactions, you eat a certain food protein, days later or up to a month later, it will whack you with inflammation. But if you don't know what's bothering you, because it doesn't bother you the obvious immediate way, you keep eating it until you go, holy cow, where is all this inflammation coming from? Gotta be something. I know it's not what I'm eating because nothing makes me feel sick. Well, not in the obvious way, but the sneaky way, but this is easily tested. Vitamin deficiencies, hormone imbalances or deficiencies, such as the estrogen dominance, and then environmental toxins. We live in a very toxic world, so difficult for the system, brain, immune system, etc. Next slide, please. So the test to run, we kind of talk about it's always nice to test so we don't have to guess. Now, the science is very clear what's going on. So in certain situations, including certain countries where it's hard to run some labs we might want to run, that's okay. But if we can pinpoint what's wrong, because everybody's unique, blood work, saliva cortisol, always the best way to check saliva, really the only way to check saliva. Digestive stool analysis, provocative heavy metal test. You never want to do a heavy metal urine test without it being provocative. And then that food sensitivity test that I mentioned. And truly, this blood work can be run in any lab. It's nothing super fancy. And with the right codes used, diagnostic codes, it should be covered by pretty much any insurance. Next slide. So now that people know what labs to run and the particulars, exactly what blood work to run is actually in my book, but also a big problem is people treat the reference ranges on the results sheet from a blood test as if that's where the healthy people are, but it's not. It's actually based on statistics. You have to be the 5 worst out of 100 people, the 5 worst out of 100 people at lab tests to actually fall out of the range. So we talk about if you fall out of the range in one particular blood test, you're an F on your test. If you're in the range, you're just someplace between a D- and A+. There's so many people, oh my gosh, you can feel so crummy and keep feeling worse and worse. Do a blood test and you're told, oh, your results are in the range, you're fine, you're great. I don't know why you don't think you're feeling good because your labs say you should feel good. But this is the problem. And this was a Harvard study done many years ago, 2008, where they said, okay, fasting blood sugars, the range might be 70 to 100, some places 70 to 110, kind of depends on what population they're testing as far as what the range gets to. But even 1 point above 84, you now have a 6% chance of getting diabetes in the next 10 years. So you can be a 94, well within the range, and have a 60% chance of being told you have diabetes in the next 10 years. So you can be well within the range and still be really far from where you have to be to feel great. Next slide, please. Okay, the big ones, the pearls, game changers. Next slide, please. Infections always are going to be there, and they always need to be treated. These are the ones that drive chronic disease. Now, some of these infections get in from the outside, such as mycoplasma, such as herpes virus 6. Some are in everybody's system, but should stay dormant. You got to have a healthy immune system to keep them dormant your whole life, like Epstein-Barr virus. Some come from the gut. They could be infections from the gut that get out of the gut and the bloodstream go over, or they could be like viruses, like adenoviruses that are in the gut always, but you never want to let these dudes get into the bloodstream and go all over. So these adenoviruses will go to breast tissue, increase your risk of breast cancer. The adenoviruses will go to the cells in the pancreas to make insulin. They stop making insulin, type 1 diabetes. Ooh, we got to get rid of these dudes. Next slide. So there are so many infections that can drive chronic disease. Sometimes we test for them and identify, sometimes we can't test for them. They're hard to find on testing though. So you always want to use a broad spectrum antimicrobial that will get rid of any infection, no matter where it is in the body, no matter what type it is, whether we know it is there or not. So we love a nanosilver product out of Canada, and it'll get rid of any infection, no matter where it's at. It's called pH structured silver solution. Now, the water, though, the structured water, oh my gosh, this is so cool. This is a fascinating book here about the silver solution, but also a fascinating book about the fourth phase of water. Most people in high school or junior high had to have a science test, and they asked, what are the three phases of water? Solid, liquid, and gas. But there's a fourth phase, structured water. This will actually, it's such a nerdy, I love it. It's the biophysics of water molecules, not biochemistry, biophysics of water molecules. It helps get rid of inflammation, helps damaged tissue heal, and studies on skin cells tell us that it works through epigenetics. It actually turns off bad genes, turns on good genes in our cells to allow the healing process to take place. Next slide. Including this nano silver can get rid of malaria. It can get rid of anything. Next slide. Always consider low dose naltrexone. Now, naltrexone at high doses, 50 to 100 milligrams, used for addictions. But at pixie dust doses, we're talking 1.5 milligrams, 4.5 milligrams, in that range, smaller for children. It's lovely. It's an immunomodulator. It rebalances the immune system. So it brings down overactive stuff, brings up underactive stuff, brings people right back to the middle. Thus, it helps us get rid of autoimmune disease, allergies, asthma, and eczema as well. But it helps us get rid of the infections, keep them away. It helps prevent cancer, but also through a couple different mechanisms, it helps the body control inflammation, excessive inflammation that would otherwise drive chronic disease. A big review article a couple years ago said, well, geez, here's something with no side effects, can help you fix about anything. Should everybody be on it that has a chronic health issue, question mark? Very good question. Next slide. I always need to address that stress hormone cortisol, typically mid-teens or older with an adrenal adaptogens such as ashwagandha, rhodiola, cordyceps, those kind of things. Children, mid-teens or younger, they're still good at healing. You don't need this. You just got to get rid of the things that are causing physical stress, like the infections and the vitamin deficiencies and the hormone imbalances. They'll fix themselves. Next slide. So now we're talking, these things that are the biggest things, like a lot of the supplements we use, will work through epigenetics, turning off bad genes, turning on good genes in every cell in the body. So this is where doing relaxation things, meditation, repetitive prayer, progressive muscle relaxation, yoga, tai chi, getting out in nature. Nature does this, works through epigenetics. So here's this Harvard study where they said, oh my gosh, meditation does work through epigenetics. It turns off the bad ones, turns on the good ones. Oh my gosh, this seems like exactly what you want to do for just about everything. Thus, we ask everybody to do this as part of the healing process, but it's also going to be the type of lifestyle change a person's going to want to do long-term in order to maintain their health long-term. Next slide. So in a perfect world, we prevent autoimmune disease. In a perfect world, everybody knows that if you get an autoimmune disease, it can be reversed. In a perfect world, they're not told that their only option is an immunosuppressant medication. Oh, and I forgot to say this. So remember that slide where the loss of the set point, autoimmune disease is up, cancer is down? Well, this is why those immunosuppressants increase your cancer risk. But when you've lost that set point, moved away from it up and down at the same time, you have an increased risk of cancer right from the get-go. So the immunosuppressant medications, by suppressing the immune system, taking it all the way down to the bottom, that's why people that are on those meds are told, oh, by the way, you're going to have an increased risk of cancer. Well, you already have an increased risk of cancer just by inherently losing the set point in the middle of your immune system. And now you're on a medicine to make it more likely to get cancer. Your body says, no, that's not what we want. We don't want immunosuppression. We want immunomodulation, rebalancing of that immune system. So here's a lovely study published in Lancet out of northern Finland. They took every child born in northern Finland in 1966, followed them for 31 years. They asked half the parents to give their child 2,000 IU vitamin D first year of life. Don't care what you do after the first year, but we're going to follow you for 31 years. The other half of the children really didn't get anything. So 2,000 IU of vitamin D is basically pixie dust doses of vitamin D. Nobody's going to get therapeutic on 2,000 basically, but at early enough ages, a little bit goes an extremely long way. Now, we also know that if a woman's vitamin D is above 50 during pregnancy, she's automatically decreased the risk of her offspring getting multiple sclerosis by 50%. So vitamin D levels during pregnancy, profoundly important. Early in life like this, they found a 90% decreased risk of type 1 diabetes. Oh my gosh, 90% less of these children ever ended up getting type 1 diabetes, at least the first 31 years of the life. And they found that some of the children who took vitamin D some days, but not others, 82% less risk. Oh my gosh, the body's so smart. We don't even have to be perfect. As long as we're perfect enough, we're putting the body in position to either reverse things or, as we see here, prevent things your whole life. Next slide. It is projected that 600,000 young people in the US under age 20 will have type 1 diabetes by 2050. But we have 6 years left. If by 2030 everybody knew about this vitamin D in the first year of life, we would prevent over 500,000 young people getting type 1 diabetes. And because we're talking always about these central mechanisms, it's never just one thing that we're addressing. We're addressing multiple things at the same time. These children in northern Finland, early use of vitamin D, they didn't get schizophrenia either. Hugely important for brain development, such as any brain stuff. Schizophrenia was the one they studied in this study. Next slide. There's a revolution out there. I would love to invite everyone out there to join the revolution, because we got a revolution. You got to revolution. These are some of the things that are out there that we're using to educate people, including 2 different levels of courses for non-medical people, 2 different levels of courses for medical people, and my book, etc. So I want to say thank you. Next slide, please. And I know you're gonna love what Dr. Swathi has to say about the CBD cannabinoid system. Ooh, I can't wait to hear it again. Thank you, everybody.
Amazing. Thank you so much, Dr. Bilstrom. Very much enjoyed the background on autoimmune conditions and really how, really setting the stage for how CBD can play a role. And I really loved also how you talked about so many different, what I call, as an integrative pharmacist, thinking about so many possibilities from a patient-centered perspective that can really help a patient. So this is one of the possibilities that I think would be incredible for patients. And this is talking about the endocannabinoid system, and specifically how one active component, CBD or cannabidiol, can really play a role in the immune response and autoimmune conditions overall. Let's see if it'll go to the next slide. Yes. Okay, so my learning objectives here are to introduce the endocannabinoid system and a little bit about the cannabis plant. We'll talk a little bit about how the endocannabinoid system works, and particularly how it interfaces with the immune system for its overarching goal of homeostasis. And then I will also discuss potential roles that CBD can play in managing autoimmune conditions, especially given the background that Dr. Bilstrom has provided us. So this is a little bit about the endocannabinoid system. Quite a few people on this call probably know a bit about it already, whether that's, learning from me on previous webinars or learning from other speakers who have come to talk. But the endocannabinoid system is a vast network of various receptors. The most famous cannabinoid receptors are CB1 and CB2. That stands for cannabinoid type receptor 1 and cannabinoid type receptor 2. But beyond that, there are not just cannabinoid receptors, there are also what are called non-cannabinoid receptors. So those are receptors that are actually parts of other systems, but are interwoven in this, network of different receptors, and really speaks to how the endocannabinoid system doesn't just work in its own silo, but it works in collaboration and synergy with a lot of different other systems. And so with the endocannabinoid system, we produce our own endocannabinoids. Those are listed on the bottom of the screen. One of them is cut off, unfortunately, but one of them is, oh no, sorry, they're both there. Anandamide and 2-AG. You might see anandamide also listed as AEA if you're, looking online in different places. And 2-AG is just a short version of 2-arachidonyl glycerol, but we just call it 2-AG for short. And so the reason that the endocannabinoid system, or our bodies in general, produce endocannabinoids is because of the endocannabinoid system's goal. The goal is to promote homeostasis. And to relate it to what Dr. Bilstrom talked about, it's the immune set point, but in the context of the endocannabinoid system. And this is why the ECS is so important in this discussion, because it plays a role in the immune set point, given that its goal is to work with all these different systems, whether directly or indirectly, to really benefit the body and promote balance. And so when we're thinking about how we can promote balance, some of the things that Dr. Bilstrom already talked about, like meditation, what a wonderful, discussion about that, especially from an evidence-based perspective, but CBD, or which falls into the phytocannabinoid, which you see on the screen here, phyto just meaning from a plant, and cannabinoid being, the active component of CBD. So that's one of the ways that we can work to amplify the functionality of the endocannabinoid system. As I mentioned, our body creates endocannabinoids, and also other integrative modalities like meditation, and of course, nutrition and supplementation also can really play a role. And so here I have a little bit more information on CB1, CB2, where they're primarily found. But in particular, CB2 is the receptor that, especially in the context of this conversation, is the most important. CB2 has been known to play a role in immunomodulation and anti-inflammatory responses, and also in pain modulation too. So that's the receptor, especially as it relates to the ECS, that we are going to focus a little more on today. And a lot of the research that has been done with the ECS and the scope of autoimmune conditions, they really focus on the CB2 receptor. And I guess I didn't say in detail, but the CB1 and CB2 receptors are found throughout the body. And so very different from, let's say, cardiology or like heart disease, let's say, where the receptors in the heart are very much focused on, within cardiology, we're looking at receptors in the heart. Whereas the endocannabinoid system, the receptors are found in a lot of different organs and tissue and receptor systems throughout the body. And so it really plays and speaks to why the ECS is important in something like, the immune set point and in immune regulation. And so one of the really interesting studies that I need to speak about is the activation of CB2 receptors has been associated with the modulation of immune cell function, and in particular in particular, not only immune cell function, but also cytokines or inflammatory response molecules. So these cytokines are involved in, really, you might have heard of cytokines a bit more recently with the COVID pandemic and everything, but really cytokine production and the regulation of it has a lot to do with the endocannabinoid system. And when you have that increase of cytokines, the chance of you being, above that set point is you probably have an overproduction of what is going on in your immune system. And when you have that overactivity, you definitely don't want that, but you also don't want the underactivity, as Dr. Bilstrom talked about. So we really want to try to get to the set point. So the ECS can play a role in the regulation of cytokine production, meaning that you get, from the overactivity a bit farther down, closer to the immune set point. This is, of course, if the ECS is working at its topmost function. So many things can throw off the ECS, one of them being, environmental factors, stress, anxiety, all of those things that, that Dr. Bilstrom mentioned that are associated with overactivity can also throw off the endocannabinoid system and therefore, indirectly also affect cytokine production. So very interesting. And this is why, especially when we're talking about the autoimmune system, and sorry, we're talking about the immune system, we're talking about autoimmune disease, talking about the ECS is so important. And so now I wanted to give a little background on CBD. So CBD, or cannabidiol, again, a lot of people on the webinar might already know, so this might be a review for you, but still wanted to mention it here before we talk a little bit more about some of the studies. And so CBD, as you might be familiar with, is a non-intoxicating cannabinoid. The terminology now used in the healthcare provider community is more non-intoxicating rather than non-psychoactive. Psychoactive means, in layman's terms, really means like it's active in the brain. And we now know that CBD and THC are both active in the brain, which means they're both quote unquote psychoactive. And so the terminology has kind of shifted where CBD is thought of as the non-intoxicating cannabinoid versus THC being the intoxicating cannabinoid, or one of rather. And so that's why I put that terminology on here if you're wondering what that means. It just means that, non-intoxicating means that if you take CBD, especially as an isolate or broad spectrum, meaning that it has 0% THC in the product, you will not feel a high if it is a reliable product, that has third-party testing and all of that. CBD, or cannabidiol, is found naturally occurring in the cannabis plant at high percentages. And a lot of the products that you see on the market, the ones that are not in dispensaries in most states, are actually hemp-derived. Hemp is another version of cannabis. If we think of cannabis as like an umbrella, there are a lot of different kinds of, plants within cannabis. Hemp is one of them, and hemp is bred to have higher percentages of the higher percentages of CBD and very low percentages of THC. As per the 2018 Farm Bill, there is only up to 0.3% THC is allowed in a hemp-derived product. So even if you see a hemp-derived CBD product, it might say it has THC. It only has up to 0.3% THC if it is sold outside of a dispensary, because that means, it is abiding by the 2018 Farm Bill, and you can find it at grocery stores or other places as well. And the really interesting thing, at least from my, my scientific, nerdy perspective, is that CBD actually doesn't have a direct relationship, or really an affinity is kind of the fancy term, for CB1 or CB2. It does have, kind of as the image demonstrates on the left side, there is a relationship, but at the end of the day, its main way that it works with the endocannabinoid system is actually modulating other non-cannabinoid receptors. That might be a little confusing, but in the context of this discussion, it makes a lot of sense, because some of these receptors also, that I have bolded on the screen, also play a role in the immune response and in anti-inflammatory pathways. It also speaks to why CBD could be used for quite a few different things. But at the end of the day, the endocannabinoid system, as I mentioned, its goal really is to promote homeostasis or balance. So CBD, when you incorporate it into your daily routine, it's really working with the ECS to promote this idea of balance. And so, whether you're, and this is also why CBD is only a part of the comprehensive treatment regimen for, let's say, whether it's an autoimmune disease or, a lot of other conditions as well that it could play a role in, whether that's, pain or anxiety, or, like improvement in sleep quality or quantity. It's all about how it works with a lot of other things that you're doing. So CBD can be incorporated, work with the ECS. The ECS then has downstream effects on other, organ systems or, neurotransmitter systems. But at the end of the day, that's one of the things that you're doing. You know, what does your nutrition look like? How are you dealing with environmental exposures? You know, what do your relationships look like? Are those healthy? Because those also infiltrate in the way that your body, you know, produces and manifests disease as well. All right. And so these are some of the potential benefits for CBD in the context of autoimmune disease. In particular, the CB2 receptor has a relationship with the NF-kappa B signaling pathway. This is, again, a fancy pathway. You don't need to know all the details, but really this pathway is very important in inflammation. And so CBD may help and be involved in the reduction of inflammation. Again, thinking of the immune set point, an increase of excess or unwanted inflammation will be above the set point. And so CBD can be one of the players to help bring down that excess or unwanted inflammation to then, you know, help promote that balance or homeostasis, or in this context, you know, the immune set point for patients. And then pain management, a lot of the root of pain comes down again to this idea of excess or unwanted inflammation. And so it works particularly with this bolded, you know, receptor here, TRPV1, to exert its effects of, you know, anti-nociceptive or like anti-pain behavior. And so that helps not only with the pain itself, but also more of the root cause of the pain being inflammation and the perception of the pain too, which is really important. And then it can also have antioxidant effects. A lot of this, again, coming back to inflammation and how can we get our body back to balance. Okay, and then other potential benefits that play a role in this discussion. One of the things, you know, when we were talking about all of the, you know, the top 7 things that, you know, patients with autoimmune conditions need to think about. One of the top ones, I believe it was number 1 or number 2, is cortisol. And so I definitely wanted to call out that there are some really interesting ongoing studies about stress modulation. And again, thinking about, you know, inflammation and its role in all of this, I think is really key, and how our body wants to and strives to be in balance and is working towards that. In the ECS perspective, it's producing our own cannabinoids, so the endocannabinoids, and sometimes to benefit that and to work in synergy, we also incorporate things like phytocannabinoids like CBD or THC that can be added in as a supplement so that we can think of how to really optimize the system. So cortisol, hormone regulation as well, quite a bit of what Dr. Bilstrom talked about was estrogen dominance. So I cannot wait to see more research that comes out on CBD and its relationship with estrogen and other sex hormones and how that can also play a role. And then, of course, blood sugar regulation is so important as we see more and more, you know, patients getting diagnosed with whether it's type 1 at a younger age or type 2 diabetes throughout their life. How can CBD also play a potential role? There's some interesting research about the blood-retina barrier, but at the end of the day, we still need more studies to determine where CBD can fall in the spectrum. But at the end of the day, I think CBD can be a really incredible asset if we're looking from a root cause perspective, whether we're thinking about inflammation and the immune set point, and how it can be used with a host of a lot of other modalities to really have the best effects for patients. And I believe that is all. So I will stop sharing my screen. I think we're doing pretty good on time. I will pause right here and see if anyone has any questions. Sasha, if anyone has any questions, please let us know.
Yes, well, we actually just have one that has come in so far, and it's a pretty good one. And I think that this could potentially be for both of you to answer or just offer some insight to. So this individual said, my autoimmune disease means I'm going in for steroid shots a couple of times a year for flare-ups. If I'm using CBD or another cannabinoid and know I'm going to need a steroid shot coming up, should I stop using my CBD?
That's a great question. I would say that From my perspective, I would want to understand what other medications you're on, what your regimen is, also like what particular, like what particular injection are you getting, because it depends on, a lot of different factors. So I don't want to say, one way or the other on the call, but if you do have more specific questions, you can, reach out to me, and I'm happy to talk about some of the potential, drug interactions or lack thereof. But I will also pass it over to Dr. Bilstrom if he has anything to add.
I think one of the key words in that question is when I need to go get my steroid shots. And I think the need is maybe not quite the right word. So steroids get rid of inflammation. Anytime a steroid's used and it helps you feel better, whether it's a shot, a cream, we use steroids a lot in medicine, of course, a cream, you shoot it up your nose, shoot it in your lungs, shoot it in a joint, take it by mouth, like prednisone. It always begs the question, well, why do I need something from the outside to get rid of inflammation? Why can't I do it on my own? So whenever you feel better with a steroid, it always tells you that cortisol's off, because cortisol is designed to convert to cortisone, which is a steroid hormone your body makes to get rid of inflammation. The problem is when cortisol, because of all the things that are going on in the body, all this physical stress and probably more emotional stress would be ideal. Cortisol gets kicked up into the stress mode and gets stuck in the stress mode, stuck in this fight or flight mode, life or death mode. There's basically a bear chasing me, trying to kill me 24 hours a day, 7 days a week after week, month after month. Well, when cortisol gets kicked up and stuck, we can't fix anything. It's just one thing after another after another. And one of the reasons is when cortisol gets kicked up into the stress mode, it becomes very inefficient at converting cortisol to cortisone to get rid of inflammation. So, but every time you use a steroid, it totally whacks cortisol. And the last thing you want to do is whack cortisol when cortisol is already so whacked, you can't get rid of inflammation. Cortisol getting kicked up into the whacked position suppresses the immune system. And that's where you start getting all these infections, driving chronic disease. Cortisol throws off the hormone balance. The whole steroidogenic hormone production cascade is thrown off. The very first hormone that drops once this cortisol is kicked up is progesterone. Oh, here comes this estrogen dominance thing. So actually, we always talk about, well, you got to do what you got to do to get through your day. But when it's not really getting at the underlying issue with like steroid shots or immunosuppressive medications, and steroids suppress the immune system, you really want to spend time going back and doing your due diligence and figuring out what's going on, so that you can actually fix what's going on. So, the steroids, even though they get you through your day, it actually just makes things worse and worse over time. So I'd always recommend, well, okay, go ahead and do that. But if we fix things, you're going to feel so much better in multiple areas. Your immune system set points reestablished. You get rid of what's causing the inflammation. You're not even going to need the steroids. So that's where that word need, I didn't think it was quite accurate.
No, yeah, I'm glad that you that sparked some other discussion about that, and actually it sparked another question to come in as well. Is there a recommended amount of milligrams for CBD or THC to take on a daily basis to regulate your cortisol levels?
Ooh, good question. Again, I think this is a very patient-specific question. Like, are you cannabinoid naive? Like, as in, have you taken cannabinoids for many, many years? Or like, are you a, recreational or medicinal smoker? A lot of questions like that are important, because there isn't like a set dose where it's like you take, insert double-digit number here for a certain thing. It's really like I always like to start patients at a low dose, but it's very dependent on like what medications are you taking, because it is possible you have a drug interaction, and it's possible like CBD interacts with that, and we always want to optimize benefit versus risk ratio, so it might not be the right fit for you. But like, let's say that it is, are you, as I mentioned, are you cannabinoid naive, or have you been taking cannabinoid products for a while now? If you are more familiar, then I'm more comfortable starting at a higher dose. But if it's new to you, then I would rather start much lower. Again, but it's more complicated than that too, because it's not only is it CBD, maybe there's like a combination of CBD and other cannabinoids that could really benefit you. But I would also want to understand, what are you doing from a lifestyle perspective? What is your nutrition? and what are like some of the other components of your day that will really help inform the dose. So it's a bit more complex than just a blanket dose. So but that's of course my perspective. Other people have different perspectives. I'm a pharmacist, so that's the way I think, is like, how can we help the patient, but also ensure that we're, being, I'm trying to optimize as much benefit as possible, but I don't want to add too much risk at the same time. And I also want to ensure safety. So yeah, again, like if you have any questions, please do not hesitate to reach out to Sasha. She can forward me the question, or you can reach out to me via LinkedIn or otherwise. And definitely please let me know if there's some way that I can help.
I think another two words on this question I find compelling is long-term. Now, like the person with the steroids, if you don't get at the reason why the inflammation is there, well, you got to keep using the steroids long-term. But if you fix the reason why the inflammation is there, the inflammation goes away, you don't need it long-term. So this is where, like with using the endocannabinoid system, is you mentioned that one pro-inflammatory cytokine, NF-kappa B, NF-kappa beta. And the gut being such a central mechanism, when these real central mechanisms in the gut are thrown off, all this inflammation is produced to the point where the lining of the gut actually starts making its own chemicals that create more inflammation, including the NF-kappa beta. And this is where they talk about the gut can become this engine of inflammation. Inflammation starts it, the lining of the gut makes NF-kappa beta make more inflammation, the gut gets more messed up, it makes more NF-kappa beta, you get this vicious cycle going, right? And you're stuck, and it's just engine of inflammation the entire body when the gut becomes this engine of inflammation. So you got to break the cycle. So if you're talking about something like that, the endocannabinoid system using that, well, if you can stop the overproduction and lining of the gut, for example, of this pro-inflammatory cytokine NF-kappa beta, you've broken the cycle. Well, now you can heal the gut. Now you can start healing the entire body, and you might not necessarily need to use whatever it was that you used to break the cycle, such as maybe endocannabinoid or a cannabinoid product, because now you've broken the cycle. Now you can fix everything. You might not even need it long term.
Yeah, definitely. I think that's a great point, is that sometimes, with supplements, especially like we kind of like the way that we're educated on like drugs is that, oh, you take them for the rest of your life. But certain things like steroids, for example, were never supposed to be taken for the rest of your life. SSRIs were not meant to be taken for the rest of our lives, right? So I think that's the same thing with CBD, is like, when can these supplements be added, or even like different lifestyle modalities, like when can certain things be added into your life to help to get you to a point where then maybe you transition and don't need it anymore.
Yeah. We tend to find that we always tell patients initially when we start recommending things, we say most of the stuff is going to be temporary. Once your body gets healthy enough, sturdy enough, it's going to take over and do it itself. We just got to put your body in a position to do that. Then once you say, oh my gosh, I feel so much better, I'm like 80, 90% better overall, everything that was going on, not just my worst problem, oh, like I'm attacking this body part, but I'm tired and I got brain fog and I'm constipated and my skin's too dry, my nails crack and all this kind of stuff. Well, 80, 90% better overall. All right, your body's really taken over. It's doing a great job compared to what it was doing before. We'll start pulling back on things. And usually people need very little to keep them going, especially when you have some nice lifestyle stuff going on, like, optimal sleep hygiene, getting out in nature, doing your relaxation stuff, eating high quality food. You can maintain it on your own. Don't necessarily need much of this to maintain it long term.
Yeah, I really love that you both just echoed that, because that's something that we even talk about Realm of Caring, is just because you're on it now doesn't mean it's a lifetime sentence of taking that. So since we're running out to the hour, I would like to leave our community with something, because we do love to provide everybody that comes to Realm of Caring with just some tools, how to talk to your doctor, how to bring this up. And because autoimmune disease can present itself in so many different ways, what are good takeaways for the patient so that way they can advocate for their health when they're going in, if they believe that what they have could be linked to an autoimmune disease? What could they do, or how could they start that conversation with their healthcare professional?
I think one thing to know is that we know where this stuff comes from, and we know how to reverse the process and ideally make it go away. And so often people are told, if they ask the question, why did I get this? We have no idea. Well, how can I make it go away? You can't, you have it for life. Well, that just means that person doesn't know where it came from and what to do. Now, that person might be great at helping you with the medications that you need to actually get off the couch, take care of your child, get to work and back. Don't ask me to use those medicines with you. That's not my thing. But it's so important to know that it's out there. And we have 2 different courses for non-medical people, but also we have a free course for medical people. All it takes is about 70 minutes. We really want to educate medical practitioners about why people might be making the choices that they are making, and that they're based on the science. Very important to know that this is the science, not, of course, one person's opinion. This is the science. And if you're not feeling good and nobody can quite figure out why, you can probably bet there's an autoimmune thing going on. And there's specific tests to run to identify it. They may not be the specific test that you get on like a once a year test or like that. But I would say, well, my book goes into more detail, and maybe ask your practitioner, like, here's this, book that talks about these tests. Would you be willing to run these tests? I even give people the diagnostic codes that the physicians can use to justify it for insurance coverage. Even though that doctor may not know what code to use, they're right there. And then they can run it. You find things that say, oh, I was right when I was thinking this might be what's going on. Well, then you're halfway there because you know what you're dealing with.
Yeah, that's great. Well, thank you so much. And when we get this uploaded onto YouTube, we will go ahead and make sure all of those links are below for Dr. Bilstrom's book, as well as the courses. I want to thank you both so much for joining and sharing your insight and knowledge with our community. It is very insightful and very helpful to us. And thank you just so much for being here. I appreciate you both.
Thank you so much.
Okay.
Bye-bye.